All right. So I was we did an X Spaces last night with Sean Hendricks. We talked about Limes. It was actually really good if you guys want to go listen to it. But one of the things we talked about was the rise in the pharmaceutical groups, and everybody has started using influencers to come out and say stuff, and these guys are funding them, so they're getting more followers, they're getting more speak, they're getting out there more, and they're saying all sorts of things about vaccines and about natural medicines like that that are most of them are lies, but they're really interesting the way they're doing it. So I was having a discussion with somebody not too long ago, and their whole thrust was that the COVID vaccine has saved millions of lives, which I thought was an interesting comment to make, how you can prove that it saved millions of lives. And I was like, what is your evidence of this? And they said, well, look how many people died from COVID before the vaccine and how many people have died since the vaccine. And they were using numbers from the CDC, and they were using numbers from, the government, numbers from here. The thing about that is that if you look at those numbers of how many people died from the COVID vaccine, and who died from COVID, at the beginning of the COVID scare before the vaccine, and how many are reported to die now, the numbers are drastically different. And I think this was, now that in hindsight, it's like, oh, well, this was to show efficacy of the vaccine. But if you guys will remember back, this is a very important thing not to forget. If you guys remember back during COVID, everything that people were in the hospital for, everything, motorcycle wreck, gunshot wound, everybody was dying of COVID, because the way that it was set up was that if you said that COVID was the reason they died, or was partially the reason they died, the government would pay you for saying that. So what ended up happening was that everything was COVID. We talk about, people were talking about this all the time. You can probably go back and find it now. People were talking about, oh, my dad died of cancer, but they had it listed as COVID. This guy got a motorcycle wreck and broke his neck, but they listed it as COVID. And so what ends up happening is you have these giant numbers. And look at the flu. Go back and look at how many people died from the flu during COVID, because it was like 70,000, 60,000, 70,000, 27. But so all those people were now reclassified as dying from COVID, because if you had a respiratory anything and you died, the hospitals would be like, oh, that was COVID, pay us. And so what ended up happening was that these giant numbers of death from COVID. And then after the vaccine was allowed to come out, they didn't care about the lies anymore. So they quit paying the hospitals to say everybody died from COVID. And all of a sudden it looks like, oh my gosh, so much fewer people died of COVID. So if you look at the year of COVID, and the flu is almost nothing. The next year, the flu is back up to 60, 70,000 deaths. So what ends up happening is it looks like that, oh my gosh, yeah, if you look at the numbers after the vaccine rolled out, so few people died from COVID. Well, the numbers were inflated on the other end. One, to raise fear and to make people would do the vaccine. But two, now that we look back retrospectively, it was to pump up the numbers so they could show that the vaccine actually did stuff. When I think we've all noticed that the COVID vaccine does not prevent transmission. It does not prevent you from getting COVID. It does not prevent you from having COVID issues. It doesn't do any of those things. However, it does cause heart attacks and strokes and all sorts of other issues and cancers and things like that. That's what we've seen. However, they're trying to shape it now and be like, no, that's not what happened. Look at all the deaths. Like, there's so fewer deaths. That's how they're getting this number of COVID. The COVID vaccine saved 2.5 million lives. That's where they're getting these numbers. And so we have to all kind of recognize we're in a really, really, really interesting space where the pharmaceutical groups are paying influencers and making up influencers and creating bots to push their narrative. And they have a gigantic amount of money behind them, so they can make sure that everything that goes out looks the way they want it to look. And so that's something that we all have to kind of start recognizing is, for every influencer who comes out and who's like looks at the Hep B vaccine and goes, they studied 150 people for 4 days, and since none of them died, they said that it was completely safe. Well, that's not how you do studies. They've never done any studies. The only longitudinal study we have on vaccines at all is the Ford study that showed that kids who got vaccinated were substantially less healthy than kids who did not get vaccinated. And all the medical guys were like, well, you can't count that as a study. Fine. medical guys, you show me your studies of vaccinated versus unvaccinated over the course of 5 to 10 years. Longitudinal studies of drug, which is supposed to be something we do all the time. Show us the placebo-controlled trials. Well, you don't have any of that stuff. Yeah, okay. So this is kind of where we're at with, you know, the medical industry and the influencers and stuff like that. So when you see stuff online, you know, regardless of what side it's on, you either need to make sure that you know and understand and trust the people who are saying it, or that you get it vetted properly, because a lot of the stuff that's coming out is not accurate. You know, everybody keeps. I love the whole. You know, that's why I did the stuff on ivermectin and fenbendazole, because those, you know, everyone was like, oh well, you know, the alternative people think that cancer is a parasite. How stupid are they? No. Like the actual science of what's going on with ivermectin and fenbendazole show us the opposite of that. So this is a really weird deal, because a lot of people are coming out and saying all sorts of different stuff. You guys need to make sure that you're getting it vetted. And I would not trust anyone from Europe. So in the UK, we talked about this a little bit yesterday, in the UK, if you say anything against what the government line is, you can go to jail. Like, they're putting people in prison for making comments about immigration or making comments about, you know, anything that is anti-government. And remember, they have socialized medicine. The government runs their healthcare. So if any doctor comes out and says anything negative about the government or about their healthcare or about the way the healthcare is run, they're running a risk of being put in prison. So, you know, you can't trust anything from anybody in the UK, whether it's, you know, as long as if they're saying something that the government would like them to say, you can't trust that at all. Maybe it's true, maybe it's not. What you can know is that if they said anything negative against the government or the way the government runs or anything about their healthcare, they can be put in prison for it. So start checking out, if you're on X or whatever, start checking where these people are from. If they're from the UK, if they're from Europe, you can't trust anything they say, because everything they say has to be according to company line or according to government line, or else they could actually go to prison for it. So keep that in mind when you start seeing stuff and you're like, I don't know, man, I've heard different things about this. You know, just look at who it's backing. Is it backed by the government or by, you know, billion-dollar pharmaceutical companies? Some of that stuff might be true, but you need to vet it. So just be real careful with what's going on online. Don't fall into a tribalistic position where, you know, no matter what this person says, you listen to it. Vet your stuff. That's the best thing we got right now. If you guys, we do Medical Mondays on X every Monday at 9 Eastern, 8 Central. So if you guys want to check it out, check it out. Thanks for your time.